Hi, friends. Dr. Nancy Trimbley, putting the power and knowledge of your health back in your hands. I wanted to screen share with you a few things today, some real bright points, and helping you find people that think like you do and believe like I do that health freedom is at the core of our very being. As a chiropractor, I've always believed that because I have had discrimination over the years. You may have heard me say in the past, I've had people actually say to me, I don't believe in what you do. Or don't you hurt people? Don't people get paralyzed by chiropractors? It's like, oh, yes, I dedicated my life to paralyzing people. A good friend of mine who's a chiropractor, when people say things like that to her that are totally off base and totally untrue, by the way, she says, oh yeah, the paralyzing like adjustment, yeah, I was absent that day, I didn't learn how to do that. Chiropractic care is one of the most safest things you can do for your health. And I explain in my book Stealth Health about malpractice insurance, where a medical doctor, say a specialty like orthopedics, they probably spend $100,000 a year in malpractice insurance because of possible injuries to their patients. A doctor that delivers babies, it could be $200,000 that they pay per year for insurance against malpractice. I, as an individual doctor, pay 1,500. Yes, that's correct. 1,500 as an individual doctor, not 100,000. So that just is a testimony to the safety of chiropractic. But I'm going to screen share with you a few things. And one of them is a really awesome policy that came out from the International Chiropractic Association. This is one of the two national organizations in the United States. And there's also an Indiana chapter of the ICA that has adopted this policy on health freedom as well. So this is super exciting that it can say, and I'm going to read through here for you, that every individual must retain their freedom of choice with respect to a healthcare product, procedure, or medication. So if you're somebody like me who believes in just healthcare freedom, like, hey, you want to do what you want to do, and I'm going to do what I think is best for my health and for the health of my children. Do yourself a favor, find a chiropractor that is part of the International Chiropractic Association, or at least aligns with this policy on health freedom, and use them as part of your healthcare arsenal to optimize your health. Chiropractors have been saying this for 125 years, that chiropractic care and keeping the nerve system functioning clearly is part of an overall path to optimal wellness. And the other things include good nutrition, eating clean foods, getting your proper rest, having a clear mental attitude, and also exercise. So those 5 components lead to your best chances to having optimal health and wellness and being able to combat any disease or infirmity, not just the one that seems to be on everybody's mind lately. In contrast, I want to share with you a couple of other things. I had heard about this article about how physicians who post COVID-19 vaccine misinformation may lose their license. So this is fascinating. So the whole concept of misinformation is kind of a nebulous area. And this article talks about the Federation of State Medical Boards warns, this was just July 29th of 2021, that physicians or other healthcare professionals could be at a risk of losing their medical licensure. And that seemed like a lot. Now, I've heard some of my mentors in the health arena have been stripped of their licenses. If you go to I have 2 whistleblower videos about people whose books I use to write my book, people whose books I've recommended to patients for years, have been stripped of their medical licenses to even just practice because of what they may have published in a book years ago, and beliefs that they still hold today based on what they believed then when they wrote their book. So this was unsettling to me that this is now policy by the Federation of State Medical Boards. So digging a little deeper, I did go to this website for the Federation of State Medical Boards. It is a real thing. It's been around since 1912. And let's see, protecting public health and interests. Okay, so that's their purpose. And then I went over to this other article, Defeating Misinformation is Key in Ending the Pandemic. This is from the American Medical Association. Reading through this paragraph, and I won't read the whole thing, I'll just read this one paragraph here. Whatever their reasons, the result of this misinformation crusade is doubt, confusion, and division at a time when our public response to this pandemic must be unified and resolute. This sobering reality has been made clear by the Centers for Disease Control and Prevention. Roughly 99% of deaths linked to COVID-19 in this wave, and the vast majority of those with severe symptoms that require hospitalization, have come from patients who were not fully vaccinated. So this is perplexing to me because this runs in contrast to everything that I've been researching, reading, and posting videos about. And this was published just a few days ago, September 27th, 2021. Again, the American Medical Association says in an article titled Defeating Misinformation that 99% of deaths linked in this wave have come among patients who are not fully vaccinated. Well, wait a minute. Didn't we just talk about Israel? And if you don't know about Israel, go back to my video about the how in Israel 99%, or sorry, 89% of the population has been vaccinated, but they have a huge outbreak of the Delta variant of COVID-19. And right here is the article. This is from August 20th, about a month ago. Highly vaccinated Israel seeing a dramatic surge in new COVID cases. And you might think, oh, maybe they're all mild. Well, no, it says right here in this article that half of Israel's seriously ill patients who are currently hospitalized were fully vaccinated. Huh. And then if you go to, let's see, oh, this article, now this is Duke University. This was just published the 2nd of September. Duke University has 98% of students and faculty and staff vaccinated, yet they do have a little surge in COVID to 349 students and 15 employees tested positive. And only all but eight were fully vaccinated. So 8 of them were not vaccinated. And that means that the vast majority, I didn't do the math on this, but this is like 90% or something of the outbreak of Duke students and faculty were fully vaccinated. So let's reflect back to this misinformation, defeating misinformation headline from the American Medical Association that 99% of deaths were not fully vaccinated. There's a complete mismatch. So I gotta ask you, where's the misinformation? If you just only read the American Medical Association journal article here from the president of the American Medical Association, you might believe that 99% of people stricken with COVID in this outbreak are not vaccinated. But if you look at the actual reality, that is not true. This is misinformation. So I hope this video survives. Share it, subscribe, and as I like to say lately, turn off the news and go hug your neighbor. All right. Be well. Bye for now, everybody.